Hi, I'm Pastor Howard John Wesley from Alfred Street Baptist Church in Alexandria, Virginia, and very grateful for the opportunity to be part of this Bloomberg American Health Summit. Back in 1989, a very close friend of mine went to the doctor for some back pain that he'd been experiencing for several weeks. After the initial meeting with the doctor, some tests were ordered because the doctor didn't know what was causing the pain. And when my friend went through those exams, they found a mass on his liver. A biopsy was performed. It came back to be benign, but still had to be removed. And to this day, this is one of the things he would tell you. He says, I'm thankful for the pain in my back because it exposed a possible cancer in my liver. In his mind, the pain exposed something else that had to be dealt with that ultimately could have saved his life. I think the same can be said about COVID-19. This pandemic and all the pains it has caused us has also re-exposed a cancer within American society that must be dealt with. COVID-19 has been an eye-opening experience for us as a nation and as a world. But sadly, too many people have still gone through it with their eyes wide shut. This pandemic has exposed some things that really are unsightly about us as a society. It's exposed our selfishness and how people are unwilling to sacrifice personal privilege for communal safety. How we hypocritically divorce personal liberties from public health, an unwillingness to wear masks, oppositions to getting vaccinated, attending events where COVID is spread and mutates and another variant comes out and we're not able to get in control of this thing. And as a result, this pandemic has made us more aware and conscious of public health, of the responsibility each one of us has, you have, I have, towards a greater communal well-being. And with that awareness of public health, we are also forced to deal with the intersection of race and public health practices. This pandemic has exposed the systemic racism that intersects with public health. It was Harvard scholar Derek Bell in his book Faces at the Bottom of the Well who argued that racism is inextricably woven into the fabric of American society, that there is no corner of our world, no corner of our nation, no part of our policies that are not touched and affected by race. That is true even of public health. As a matter of fact, in the last year alone, some 35 states have made over 200 declarations identifying the connection between race and public health and understanding that racism is a public health crisis. But sadly, too many Americans don't see it and fail to recognize it or name it. But race and public health, they intersect when you look at communities of color that are in food deserts, where the water is still poisoned with lead, where fast food is abundant, but fresh produce isn't, where liquor stores are innumerable, and our children are raised in food insecurity. Just look at how many black and brown children are dependent upon school lunch programs to have a decent meal. And how can you be healthy if you don't have food security? Race and public health intersect when you open your eyes to the reality of a criminal justice system that harshly incarcerates black and brown bodies for substance use disorder over substances that now white corporations are making money selling legally. It's a health issue. When you look at how our government can pass a Juneteenth holiday, but fail to pass the Emmett Till anti-lynching law and substantive gun reform that could protect us from another mass shooting or school shooting or another lynched black and brown body. Health and race intersect. When you see voting rights being suppressed in black and brown communities, robbing its citizens of the ability to vote, to choose those who choose the judges that pass the sentences, and when we don't vote, we are ineligible to be part of the jury pool, which means we have no voice in the indictment of officers that have killed innocent, unarmed black and brown bodies. Race and public health interact. Race and public health meet up when parents are forced to choose between going to work and staying at home for children who now have to do online schooling, but they don't have tablets, they don't have devices. So they're doing homework through an iPhone connected through a cell signal because there's no Wi-Fi. And without correct Wi-Fi, there can be no telehealth. How can you be healthy if you can't even meet with your doctor? Race and public health interact as you see vaccine hesitation and resistance among communities of color. Why? Because they remember the Tuskegee experiment. And they remember the exploitation of Henrietta Lacks. And therefore, within these communities of color, there's systemic race issues that cause them to be hesitant and resistant to medical treatment. All you need to do is look at the disparity in access to COVID-19 testing and treatment and mortality rates. And the data shows that race is in play. You can't demonize data. You can't demonize data. I'm going to say it one more time. You can't demonize data. And our pursuit of public health demands that we not only confront COVID, but we also deal with race. That we embrace scientific data with open arms. That we address racial health inequities. That we uncover the key issues that link systemic racism to the health and well-being of indigenous, black, and Latino communities, and develop actionable solutions for positive change at the federal, the state, the communal, the organizational, and even the personal level. Pursuing public health is pursuing justice and racial equality. And this health summit and the initiatives of the Bloomberg American Health are a major first step in having the discussions of race as a public health issue and developing the solutions to fight and dismantle racism in our society. The pain of this pandemic has re-exposed the cancer of race, and we must treat them both.